But there's so many other things aside from chemo now. There's so many different targeted therapies and off-label therapies and the immunotherapy that you're mentioning as well. So let's go to really the reason for CureMatch, which is this information bottleneck, I call it, that we have now so many genes that can be tested for.
Right.
In RNA overexpression testing, you can look at 20,000 genes. Commonly used tumor-based DNA tests look at anywhere from 350 to 600 genes. And not all of those have targeted therapies yet. We have a long way to go with that, but the most common ones do, and many have numerous different targeted therapies. But we have oncologists who are like, they have large practices. They have about 15 minutes per patient as a rule. What would you like to say about oncologists' workload and the time they actually have to review data for each patient? What's your knowledge on that?
So I think that you've hit the nail on the head. Unfortunately, cancer is a very common problem, and I don't think the oncologists, there's any way that they can review all this genomic data. I actually don't, I mentioned this before, but I don't think any human being anymore can review
Yeah.
all this data. So for instance, if there's 300 drugs available for cancer patients, if you look at 3 drug combinations, that's 4.5 million. And then you layer on top of that hundreds of thousands of different variants, and you're talking about billions, maybe more than billions of pieces of data.
Mhm.
No human being can analyze that at this point.
Right.
And that's where CureMatch comes in. We've worked on the system now for over 5 years, and we input all the data. We have a system that can then decipher the data and give the oncologists with a score the best match for each patient. And we typically give 3 drug matches, 2 drug matches, and 1 drug matches, and we score all them. Usually the 3 drug matches have the highest scores. We can score specific drugs if the oncologist thinks it's an appropriate drug, so the oncologist can see how well their regimen might score as compared to our optimized regimen. But the bottom line is that CureMatch has resolved the complexity problem.
Yeah.
And
That
that
information bottleneck. Now there's a way to quickly get all of those pieces of data working for you, making sure that all the variables that need to be considered about the mutations that are involved in your cancer and other key elements are all being factored in to come up with this list, as you say.